Hello, my name is Sean Boudreau, and today we are going to talk about medicine in the United States. So we'll begin our discussion talking about some of the professions that are involved in providing medical services to people. Now, there are many professions, but the two best well known are doctors and nurses. Some of the other groups include things such as physical therapists, respiratory therapists, occupational therapists, many others, but today we'll just focus on two. So first, let's begin with nurses. In the United States, usually a person obtains a nursing degree from a university. Now, there are different categories of nurses, different types of degrees they get, and then usually in every state they have to take some sort of examination in order to be licensed to be a nurse. Now, then there are also doctors. Now, in the US, to become a doctor, first you have to go to university. So that's 4 years. Many people who are considering becoming doctors will take a special course of study called pre-med, that is pre-medical, before medical. And it covers things such as the sciences. Other people will major, that is concentrate, in something like chemistry or biology when they are in university. There are different options that they have. But irregardless, when they finish university, they have to take what's called the MCAT exams. And these exams are very, very difficult, and their scores on these exams really determines whether or not they can get into medical schools. Now, the number of medical schools is limited in the United States, so it's extremely competitive to get into medical school. And once someone gets into medical school, they are looking forward to many years of a lot of hard work, many hours, and also spending quite a lot of money. Now, when they are in medical school, typically at the end of medical school, doctors, or would soon to be doctors, have to do what's called a residency. This is when they work at a hospital for 1 to 2 years. It's only after they finish medical school and finish their residency that they are then allowed to take their state examinations, their licensing exams, which we often call the boards. That they take the boards, and when they complete those, they are actually a doctor, and they have the title of doctor, and for example, their degree is usually referred to as an MD. Now, there are many different types of doctors, and some people, when they are in medical school, they start to specialize. And they will typically spend a little bit longer in medical school. Maybe they have a longer residency as well, working in a hospital, and they will specialize in a certain field that could range from something like working with children, which we call pediatrics, to possibly performing surgery, that is actually doing operations. Now, we talked a little bit about the people who work in medicine, so the next thing I want to talk about are the places. So usually there are broadly 3 places where medical services are provided in the United States. First, there are hospitals. So these are large and well-known. They provide all different types of services. A few hospitals are public, that is run by a local government authority, but most of them are private. In addition to hospitals, we also have clinics, and clinics can be both public and private. Usually the difference with a clinic is smaller. Maybe they only concentrate, for example, in 1 or 2 areas of medicine. And then finally, the third place is some doctors have their own private office, and they will see patients, people who visit them, in their office. So I hope you learned some things today. It was just a quick overview of medicine in the United States. Thank you very much for watching, and I'll talk to you next time.